Okay, good day, ladies and gentlemen. We are very lucky today to have Amir Hakami. He's an associate professor, but also associate dean of research at the Faculty of Engineering and Design at Carleton. He's done a tremendous amount of training at places like Caltech, same place where Oppenheimer went, actually, as an aside. His expertise is really in air quality monitoring, and because there's such an intimate relationship between air quality, the environment, and health and so forth, he's been doing a lot of modeling and then using that to advise different organizations, including NSERC and NFRF, Health Canada, Environment and Climate Change Canada, and Transport Canada, American Petroleum Institute, World Resources, and others. So he has a PhD in engineering, environmental engineering as a background, same as Senator Galvez, actually. But as I said, we're very lucky to have him, and he's going to take us through what he thinks are important points for us to address.
Great.
Take it away, Amir.
Sure. Thank you very much, Richard. I'm very happy to be here. I think I have attended a couple of previous talks, and the discussions have always been very engaging. So I'm very much looking forward to discussion more so than my talk. But what I'm going to, if I can get this slide to move, I'm going to talk about climate change and air pollution and interaction between those two, and that separation between climate change and air pollution. I just want to start saying that that's kind of arbitrary because I think by now it is well established, and in all countries we accept that greenhouse gases are a form of atmospheric pollution. This was subject of debate. I mean, that probably 3 decades ago, EPA was taken to court as usual over whether they can, under Clean Air Act, they can regulate CO2 emissions. Since then, I think this, even in the US, has been established, and also around the world, that climate change is a form of air pollution. However, for this particular talk, I'm going to talk about air pollution in the traditional sense, which is the type of pollutants that affect our health, things like fine particles in the air, ozone, toxic air pollutants, and such, and climate change, basically what is caused by emissions of greenhouse gases. In that sense, I make that distinction just because of the topic, while recognizing that there is they both basically fall in the same category. Air pollution and climate change, not surprisingly, share many of the same drivers. The biggest driver of both is combustion, burning fossil fuels, which emits both greenhouse gases, CO2, but also air pollutants. There are also interactions between that traditional type of air pollutants and greenhouse or climate, both ways, in both directions. It is pretty well known that in a warmer climate, it is fairly certain that in a warmer climate, we will have higher ozone concentrations, and therefore added health burden due to ozone exposure. This is often referred to as a climate penalty. It is less uniform for particles. Some forms of particles that we are likely to have more of, some forms less of. So I think there is probably a little bit more uncertainty on the exposure to particles. But again, expectation is the expected values that the exposure to particles would also increase. Some of the air pollutants also affect climate. For example, soot or black carbon that comes from combustion, as well as ozone. Both of those have a warming effect. They absorb radiation, and therefore they result in the warming of the climate. And by contrast, sulfate aerosols They have a cooling effect because they scatter the incoming solar radiation and therefore cool down the Earth. So the level of air pollution that we are experiencing and how we contribute to that, or how we mitigate the air pollution side of it, could also have a climate impact. So that's the general topic. As Richard mentioned, I'm an air pollution modeler. I don't do experimental work. I do modeling. I'm also an engineer, and as an engineer, I'm probably a little bit more inclined to look at how we can change things, probably more so than just purely understanding them. And that has taken me and my group here at Carleton to look for ways that models, air quality models, can inform this decision-making process as it relates to different types of environmental issues that are related or adjacent to air pollution. And that overlaps with a number of disciplines. So I have ended up doing what I believe is interdisciplinary work, because as you will see throughout this talk, there's quite a bit of elements of population health or economics or social sciences in what I do. I've tried to keep the talk as much as possible free from technical aspects, but just to, when I talk about models, just to know what we are discussing. These are essentially mathematical representations of the atmosphere, and the most sophisticated form of these models is what we refer to as an Eulerian model, or as a grid model. This is dividing the atmosphere into boxes and solving the governing equations of the atmosphere in those boxes. So if you're talking about modeling, for example, the atmosphere of Ottawa, then those boxes, we can afford those boxes to be, let's say, in the order of 1 kilometer by 1 kilometer, for example. If you're modeling Canada, that would be computationally too expensive to do, so you would make those boxes bigger. If you're modeling the globe, the same way, those boxes would gradually grow. And depending on that, there is a lack of accuracy in the way that you represent the atmosphere, not just because of the size of the box, but various factors, various approximations that are used, but also limitations in our understanding of the atmosphere. So that's what those models are, as I refer to them. Air quality, or atmospheric composition, or atmospheric pollution, really is driven by two things: by weather and by what we put into the air, or by emissions. So far, we don't really have an impact, or we haven't been able to control the weather, although we have tried, and we are trying. So the only way that we can actually improve air quality is through changes in emissions. And that's where these models come in, because it is not practical to experiment with these emissions changes. We can't go out and say, okay, I'm going to remove all the emissions from, let's say, heavy-duty diesel vehicles in Ontario and see what happens. And models would help with these what-if scenarios. What happens if we do that? The results that I'm going to show later on in the presentation are a little bit more sophisticated than what-if presentations, but they essentially do the same thing. And if that is not clear, I'll be happy to explain later on. So as I said, air pollution and climate change do have the same drivers. However, when we develop climate policies or air quality policies, those are usually developed independently or separately by different people. And without much coordination. And that's not because people don't understand that coordination would be useful. It's just because the tools and the information to link the two are not readily available, or at least have not been readily available. So co-benefits come to play in this sense, and those co-benefits are defined as side benefits or ancillary benefits of climate mitigation. And they go beyond air pollution or air quality or health impacts of air quality, although health impacts of air quality usually constitutes the largest portion of those co-benefits. So when I talk about co-benefits, I'm only talking about air quality co-benefits, but there are other co-benefits of climate action that are not related to air pollution. So there are two types of co-benefits. One is that when we reduce greenhouse gases, at some point into the future, we will have less warming. And as a result of less warming or less perturbation to the climate, we will reduce that climate penalty that I talked about earlier. This is called the type 1 co-benefit. So the benefit that we would have if we could avoid climate change, or the damage that we have if we don't avoid climate change. Richard just sent me a note about WHO identifying climate change as the main threat to public health in the coming years, and that is this type of co-benefit. The type that if we have climate change, we would have, and if we can avoid climate change, we won't. But most of my talk is about the second type of co-benefit, which is if we reduce greenhouse gases, if you reduce the sources of greenhouse gases, we also get rid of the co-emitted pollutants that come with those greenhouse gases. And the prime example is combustion of fossil fuels. If you reduce CO2 from fossil fuels, we would have less particles, NOx, SO2 emitted, and that has that reduces health burden. So we would have health co-benefits, which is type 2. This is really the type that I will be mostly talking about. And talking about benefits brings me to doing something that is rather distasteful, and that's evaluating or putting a dollar value on things that typically you don't want to do, like illness, or even more so life. And as distasteful as it is a very useful tool, and it's something that economists have been doing. There's a branch of economics in valuation economics that deals with putting value or monetizing intangibles. And it is important because if you go back and if you think why we have air pollution, why we don't do enough about reducing air pollution or climate change, it's really a question of cost, because it costs money to do so. And when it comes to making decisions, if we don't have this valuation, if we don't have this monetization, we are comparing the cost of taking action with something that is difficult to compare to money, unless we have made that comparison. So putting a dollar value on things that are intangible, like deaths or life, would simplify that decision-making process. It also helps with what economists refer to as internalizing external costs, because that death is right now, it's not something that we pay for. If I'm building a car, and if I'm taking some steel from Art and building that car, if I'm taking some gas from Richard to run that car, I will have to pay for that. That's our free market. But it's really not a free market, because there are a lot of things that we don't pay for. I don't pay for the collective use of the atmosphere that belongs to everybody. If we did actually pay for all those things, maybe we wouldn't be in the situation that we are in. But we are not really in a completely free market, because there are a lot of externalities or things that we don't pay for. So that valuation also helps with internalizing or quantifying those external costs that usually go unnoticed or unaccounted for. The tricky part, obviously, is valuating life. And we usually do that through a term that economists refer to as value of a statistical life. There are two different ways of going about how estimating the cost of illness or the monetizing illness. One is for some of the illnesses is the actual cost of the illness. I fall sick, I have to go see a doctor or hospital, I use a day of productivity at work, and so on and so forth. But usually those underestimate the cost pretty significantly, because first of all, like if I don't have productivity, that is not taken into account. The child loss of the school day is not really doesn't have a monetary value assigned to it. Also, there are a lot of things that are not directly out of pocket costs. Like if I'm suffering from asthma, the quality of my life is affected. How do we account for that? And the same thing goes for something like life or death. When life is taken away, what is exactly the valuation? For something like mortality, therefore people very often rely on value of a statistical life, which is a willingness to pay measure as opposed to a cost of illness measure. And you can think of it as what is the society willing to, or how much money the society is willing to trade for a reduction in risk of mortality. And there are different ways to get at that number. One is just asking people, it's called the stated preference approach. And the other way is to look at the databases that, for example, wages that are assigned to jobs that have different levels of risk of mortality associated with them. So this is a well-established approach, a number, but it's still very much problematic and very much controversial. And for example, there's this disagreement between Europe and North America. In Europe, they don't use value of a statistical life, they use other measures. In North America, we use value of, both in Canada and the US, we use value of a statistical life. But understanding that there are a lot of gray areas in there. And I just referred to one of these, and that is the fact that a society's willingness to, how much society is willing to pay for a reduction in risk of mortality obviously depends on how much money they have. So if you are from a rich country, the VSL, the value of a statistical life in that country, would be a lot higher than for a poor country. And you can read into all the ethical dilemmas that follow. And I talk about mortality because when we talk about the health impacts of air pollution and valuation of or monetized health impacts of air pollution, very often, or not very often, without exception, that is dominated by valuation of mortality. Even though mortality happens a lot less often than morbidity or non-fatal health outcomes, its valuation really dominates the numbers that exist for those other effects. So pretty much in Canada, for example, about 94% of the health burden is assigned to mortality or to premature mortality. And that is more or less the same no matter where you go in the world. That's about valuation of life or health burden from air pollution. The same type of valuation can happen for climate impacts, and that is usually captured through social costs of carbon, which is encapsulation of all the things that are associated with a warming climate. It obviously includes all the mortality that results from, including air pollution mortality. That's the type 1 co-benefit that I talked about. So it does include value of a statistical life, but it also includes other things like sea level rise, loss of property, shoreline property, things like that. And social cost of carbon has been the metric to express that. And social cost of carbon just recently, as you probably know, was increased significantly in the US from $50 to $190 per ton of CO2 equivalent. Of course, we have to wait and see if it's gonna stick around or not. next November. But for now, that is what's happening in the US, and Canada has adopted the same number. They just converted that to Canadian dollar. So for Canada, the number has jumped from about $60 to $240 something dollars. That for the government of Canada right now, that's an internal number. So again, we have to wait and see what happens next in the political landscape. As we talk about money, so one question is that how expensive is climate action? And I think we all know that it is quite expensive. There are many studies on this and a lot of uncertainty. I only report one of them from IPCC a few years ago, probably on the lower side of different estimates at about $48 trillion over 20 years. So that amounts to about 2.5% of the global GDP, which is about $93 trillion or so. So my classes, I often use this analogy that this is the same as saying that, or as finding that you're a house owner and you are on an annual income of $90,000, and you are told that your house has a problem that could be serious. The house could crumble, something wrong with the foundation or so, and it costs $48,000 to resolve it. It's a lot of money. You can amortize it over 20 years. That would be about $3,000 a year. Again, still a lot of money, but I have a hard time thinking that we won't consider that seriously. If you put it in that perspective. And really, it is probably even more severe than that in the climate picture, if you think about it. So climate action is very expensive. But time and again, researchers have shown that inaction is just as costly, if not more costly. This is a plot from one of those studies that shows, compared to 1980, if we had started in 1980 doing something about climate change, every year after that, how much more it would cost us to do the same thing with those many years of inaction. Depending on whether you want to get to 1.5 degrees or 2 degrees, 1.5 degrees probably gone, but to 2 degrees. So as you see, while action is expensive, even more so is not doing anything in inaction. The second antidote that I find interesting is what happened with COVID-19. That for years we dragged our feet that this is very expensive to do anything about climate change. But in 2 years, we spent 10 times of what or 9 times what we would have spent on an annual basis for climate change over COVID-19, which was necessary. But I think the question is that if the urgency is felt, the money will come. And I mean, after those 2 years of extreme spending, I think we are more or less, I mean, our economies are still standing up, more or less. So this is the cost of just abatement, doing something about climate change, doing what we need to do technologically to achieve that. But this does not account for damages associated with climate change or the costs that we would have if we don't do anything. And those are the external costs. And there were various studies on this. I like this one, which is quite recent. And if you look at, depending on what level of warming, and they are not only looking at warming, they're looking at the range of things, but I think the one that you, or the the violin plot that you want to look at is really the red one, which includes all indicators and their uncertainties together. At 1.5 degrees, we're looking at damages, annual damages of somewhere between $1 to $5 trillion per year. At 2 degrees, about 3 to 8, and then the median for 3 degrees is $10 trillion a year, which is pretty much cost of COVID. So living with COVID constantly at the same level of dramatization that we had in the first year of COVID. Just imagine if we're moving in that direction. And just to put the air pollution health costs in perspective, according to World Bank, again, the estimates are plenty. This is more or less a median estimate that the air pollution costs the world something around $6.8 trillion a year. That puts it at about 6% of the GDP. So even now, air pollution cost is probably larger than climate cost, and it would be comparable no matter what level of warming we're going to experience. One last piece of information, if we look at Canada and what we have in terms of, again, if you try to put dollar values on things, we emit hopefully under 700 million tons of greenhouse gas or CO2 equivalent of greenhouse gas emissions. At the old estimate of social cost of carbon of $57, that's about $40 billion of the society or the damage that is based on that social cost of carbon you can attribute to the Canadian emissions of greenhouse gases. If we go with the larger number of the social cost of carbon, that number jumps very significantly from 40 billion to 180 billion a year. The air pollution side of things, a report by Health Canada, an updated report by Health Canada just released a couple months ago, puts the number of premature deaths in Canada from air pollution to more than 17,000. I believe that's about 6% also I'm not sure. And the valuation of that is $146 billion, which is a good chunk of, if you think about government budget, that's a good chunk of that. I do have to mention this. Doesn't mean that removing air pollution puts $146 billion in government coffers. It means that the value that the society assigns to those premature mortality and other health impacts is $146 billion. So no matter which estimate of the climate benefits or climate impact you go with, the size of air pollution impact is comparable or larger than that number. And about half of that comes from burning fossil fuels in different sectors. So things that we would have as co-benefit if we completely decarbonized. So all of that is background to see, if you look at dollar value, what does the picture look like? And I try to get to why I insist on looking at dollar values. But before that, I want to make a comparison of what is the difference between climate benefits and health benefits or health co-benefits of climate action. Or if we don't do anything, what is the difference between the health impacts of air pollution that we didn't do anything about, or the climate impact of greenhouse gas emissions that we didn't do anything about? And the biggest difference, or one of the main differences, is that greenhouse gases are created equal. Not different types of greenhouse gases, but CO2 is CO2 no matter where it's emitted. Methane is methane no matter where it's emitted. CO2 and methane are different, but that difference is just a factor. air pollutants are not created equal. There is, in fact, very significant difference or very significant dependence on their emissions, depending on where they are emitted. And this is pretty intuitive. If you have emissions that are in the city, close to populations, then those emissions are going to be more impactful than emissions that are far from the city. The reason for this is that greenhouse gases, they have a very long atmospheric lifetime. So it doesn't matter where they're emitted, they live long enough to get around, and therefore their impact would be uniformly distributed everywhere. So whether you have 1 ton of emissions of CO2 in Ottawa or in Sydney, Australia, they would have more or less the same impact. But air pollutants have a much shorter lifetime, depending on the pollutant, as short as few minutes to couple of weeks or few weeks. Therefore, their spatial reach is more limited. If they have a shorter lifetime, much shorter lifetime, they would be very local. If they have a longer lifetime, they could be regional. But it does matter where they are emitted. In fact, if you look at emissions of 2 of the pollutants that cause a lot of that $146 billion or 17,000 deaths in Canada, primary particle emissions, fine particle emissions, and ammonia, mostly from agriculture. In Canada, these curves are known as Lorentz curves. They are the basis for the Gini coefficients. If you have heard, if you're familiar with that from elsewhere, Gini coefficient and Lorentz curves are very often used to show income inequality. They basically plot the cumulative fraction of income versus cumulative fraction of the population, from the poorest to the richest. And in this case, I have done the same thing, but I'm plotting, I'm basically looking at inequality in emissions. So basically what is each ton of, imagine that each ton of emission is 1 person, and their income is their damage to the society. And I'm basically plotting or calculating the Gini coefficient for them, for those emissions. The way to read this plot is that the 10%, I assume you can see my cursor, but it's 10% worst PM 2.5 emissions is responsible for almost 60% of the burden of PM 2.5 in Canada. And the 10% of ammonia emissions is responsible for almost 50%. So that last 10% is probably 50 times less impactful than the worst 10%. So it doesn't matter which emissions you go after, or if you can be selective in which sources you're going to target, you can get a lot bang for your buck if you can do that. The second difference between climate and health benefits is that climate benefits happen because of their nature, because of the long life of greenhouse gases. They happen often far into the future. But health impacts happen now. And this is important because when we evaluate the impacts that happen into the future, we include what economists know as a discount rate, which is recognition of the fact that we usually assign less value to costs or benefits that happen far into the future. I'll get back to this, but this sensitivity to discount rates is one of the main problems with quantifying the impact of climate change or far-reaching impact of climate change into, let's say, 2050 or to 2100. The second point is that climate impacts are distributed across the globe. So when I said that the impact of greenhouse gas emissions from Canada is $40 billion, that $40 billion doesn't really happen in Canada. It happens all over the globe. So a small fraction of that happens in Canada. That brings us to something to learn from the Trump administration. the first Trump administration. And that is the fact that in 2017, they were able to change the estimate of social costs of carbon under Obama administration from $45 back then to $3. So it was, I don't remember what the range was for under Obama administration, the median value was $45 in that year, but they changed it to a range of $1 to $6 with a median value of $3. And this basically completely destroyed the benefit cost analysis for the clean power plant that the previous administration had, and it just became non-existent. But what did they argue? Not that they needed to argue, but what did they argue? The first one was that they chose the upper bound of the discount rate of 7% instead of 3%. And if you think about $1 billion damage in 2100 has a present value based on a 7% discount rate of only $6 million. But the same damage in 2100 has a present value of $106 million under 3% discount rate. So the sensitivity to the discount rate, because the period is so long, the sensitivity is really large. Probably more importantly was a philosophical point, an argument that they made, that if the administration is doing, if the US administration is doing a benefit cost analysis for actions that the US administration is taking, they should only consider costs and benefits to the US. So instead of considering the cost of, that is in social cost of carbon, to the entire globe, they said, okay, we will only consider the cost of the US. And that really dropped things significantly as well. Now, it's a flawed argument, because if everybody did that, you are devaluing the impact of climate change vastly, if every other country did the same thing. But it's a strong argument, or at least it's a powerful one in that it resonates with people. And this is, I call it a lesson, because if you go back to just a slide, health co-benefits are not subject to either one of these two limitations. So that argument would not have worked for health co-benefits, but it did work for climate benefits. First of all, discount rates don't matter because health benefits happen now, and they happen mostly here, nationally within our borders, for any country, for any large country. Maybe small countries, there would be a lot of cross-border transport, but for larger countries, it's really within the borders. And that is what the value that I think inclusion of health co-benefits has in defining climate policies, or also safeguarding them against such kind of manipulation. So this has been suggested. Drew Schindel, about a decade ago, suggested the notion of, rather than social costs of carbon, social costs of atmospheric release, which would include those things. But the main benefit that this has is that it can expand the narrative that we have about the necessity for climate action. And that expanded narrative can actually bring larger audience into the discussion. And that shifting narrative is a very important part of what I like to talk about, but also the potential that health co-benefits have. If you think about it, the opposition voice to climate change has been a lot more adept and creative in shifting their narrative and having a language and jargon that is more effective, has been more effective, because they didn't obviously have much scientific basis to stand on, but first it started with climate change. For what climate change? It's a hoax. Then it moved to, well, this has been happening for thousands of years. Then to, well, it's not man-made. Then to models are uncertain. And now I think we are past that. We are probably more into why should we pay for it? If China and India are not doing this anything, so why should we pay for it? So that shifting our argument has been staple of the other side. And I think we haven't really done that enough. And this is where the potential, there is a great potential for health co-benefits. Next time that the Premier of Alberta says that why should Albertans pay for this when India and China refuse to do so? The answer is that because thousands of Canadians die as a result of air pollution, and doing that saves Canadian lives. That's, even though we can go down the climate benefit argument and become philosophical, that is a much easier argument to win. And much more difficult argument to confront from a political standpoint. So to me, co-benefits have this vast potential that is mostly unused. But why is it unused? It is not entirely unused. It's just we have used it in a sense that, so we have not had tools so far to differentiate between different co-benefits at different locations and different sectors. People have done that just because computational limitations and because our tools were not there. So from now, for the next few minutes, I'll try to wrap up fairly soon. I'll show some results to show how we can put numbers that can do some of the things that I'm suggesting they could do. So these are mostly from a study that we just finished doing for the Health Effect Institute, and that was estimating a number of things, but including co-benefits for different sectors, mainly in the US, but also some in Canada. The problem, most of the results that I will show are for the US, because it's easier to get some of the information that are needed in the US than it is in Canada, unfortunately. So this is the type of things that it would look like. If you look on the left, you see co-benefits in dollar per ton of CO2 emitted from transit buses, diesel transit buses in the US in different locations versus the same number for passenger cars. And I also want you to pay attention to the scales. So the scale goes to 1,000, but really the values for diesel goes probably as high as $700 per ton of CO2. And for passenger cars, they don't really go above $50 per ton. Maybe actually in New York and LA, maybe they go up between 100 and 200. But for most of the country, they are in the range of $5 to $50 per ton of CO2. And you're probably familiar with, just trying to put this in context, carbon capture and sequestration has probably a price tag of, depending on the type of source, anywhere between $20 to maybe $150 per ton of CO2, just to give you a scale. Direct air capture, maybe $200 to $800. So, I mean, these are fairly attractive on the diesel side, maybe not so much on the passenger and the gasoline side, which is interesting because most of the effort to electrify have gone towards the passenger cars. Even within a sector, you could have quite a bit of variability. Now you're looking at transit buses, which we had before, but also garbage trucks and school buses. And these are all heavy duty diesel vehicles. Again, the same thing, dollar per ton of CO2 and what level you have. And then even within one sector, depending on how old that that vehicle is, you could have a pretty wide range. For example, here we're looking specifically at the school buses of different vintages, going all the way from a 2000 model to 2020 model. And you see very clearly, for example, 2007 was introduction of the new diesel standards, and the co-benefits really dropped pretty significantly. So cleaner school buses are lots less damaging than those school buses, and you would be surprised how many old school buses actually exist in the US. And I'm talking old, like 2000 level old. The one sector that is really surprising is off-road engines. And these are all these small things that they're not on the road. Like our lawnmowers or snowblowers or all those little things. The numbers here in the US, I don't have those numbers unfortunately for Canada, the numbers in the US go into thousands, many thousands of dollars per ton of CO2. The same thing for construction. So these are mostly so high because these are small two-stroke engines, which are notorious for their emissions per unit fuel used and logging. So off-road engines is where you clearly get the most public health bang for your climate buck. By contrast, if you look at electricity generation, now most of these power plants in the US, on the right natural gas, on the left coal, are in the range of probably a few tens of dollars. Natural gas doesn't really, with one or two exceptions, doesn't really go above $50 per ton of CO2. Coal, dirtier, but compared to some of those definitely off-road engines, but also diesel vehicles, not really as much impact. This is only public health impact. It does not include climate impact. We all know coal is very energy intensive. I put some of those together again in an electrification for an electrification context. And you'll see that really, if you want to get the most bang for your buck in terms of population health, the emphasis should be more on diesel, heavy-duty diesel, on off-road engines, electrifying off-road engines, and such. And obviously getting away from coal as much as possible as well. As I said, the results for Canada are a lot more limited because of the data availability. But here you're looking, so I can't do the breakdown into different sectors of different types of, for example, heavy-duty diesel vehicles. But you see those numbers for passenger cars on the left and heavy-duty diesel vehicles, all of them combined on the right. So much higher. So you're also in Canadian dollars per ton of CO2. You're in the range of few $100s per ton of CO2 in most of the populated areas. By contrast, again, if you look at electricity generation, it's a lot less. Again, that doesn't mean that electricity generation using fossil fuels is okay. It's just that it doesn't seem to be as damaging to public health as, for example, transportation is. And this is probably interesting in the context for those of you living in Ontario. You know that there's been a very strong push for independent electricity system operators, ISO, to move away from natural gas expansion for electricity generation, which does make sense. I mean, if you are moving to a fossil fuel free or net zero economy, why would you commit for the next 30, 40, 50 years to a new power plant? That said, if you want to prioritize what kind of fossil fuel you should go after, natural gas really comes at the very bottom of that list, even compared to things like natural gas in home furnaces or natural gas in gas stoves. those are probably more damaging than natural gas used in electricity generation. And you could do the same type of analysis, and we're doing the same type of analysis at the hemispheric scale as well. The same thing, you can see that the co-benefits on a per dollar per ton of CO2 are really substantial for some of the countries that are the larger emitters of greenhouse gases, India and China. And that is, as I said, about the arguments or the shifted narrative. This can also be valuable for those discussions, because that is, and it's not that this is something that is not understood. This is well known that the local benefits, the local health benefits to, for example, India and China from decarbonizations are immense. And they know that, but we can also calculate that on a fairly granular basis. So far, I talked about population health benefits of decarbonization or coordinated climate action. There was a time in 80s and 90s that when you wanted to get a regulation in the US passed, you would say, well, we do this because it is important for public health, but it also has these climate benefits. Now things have switched, that the political wind, or at least the political pressure, probably public pressure, behind climate action is larger than public health. So it's now that, if you do this thing for climate, you also get this benefits for health. So in the priority of decision making, I think climate has overtaken population health. But the third aspect is the distributional effect of air pollution. We know from around the world, multiple studies, that usually marginalized populations are exposed to higher levels of pollution. Not all pollution, there are actually some pollutants that marginalized populations are exposed to lower levels, but for particles, for example, it's usually a disproportionate impact on lower SES communities or social economic status communities. And it's not just that, it's also that those communities are also more vulnerable to any exposure of air pollution compared to others for various reasons. Lifestyle, access to healthcare, education level, etc. And it is essentially a double whammy, that they are exposed to higher pollution and they are more vulnerable to whatever they're exposed to as well. So one added benefit that if we can coordinate different endpoints in pollution prevention measures would be to also include environmental justice in that type of co-benefits in addition to population health. To conclude, population health, or the health benefits of climate action, are really large, and they are comparable or larger to climate benefits, and they can make a complementary case for climate action. The main difference between them and climate benefits is their immediacy. The immediacy both in time and in space. They happen now, they happen here. And that provides a lot of potential for an extended narrative that is more inclusive. And also there is room to extend those or inclusion or incorporation of co-benefits into measures that go beyond population health and include environmental justice. I want to finish by that last sentence, that expanding the narratives to incorporate co-benefits can help achieve a wider audience and wider acceptance. Just as I said, my experience with KCOR talks has been that there's a lot of experience and and thoughts in the audience here. So I'm very interested to know your thoughts, and if you can think of, if you have any suggestions or how to make this happen, I would be very eager to hear that. And of course, this is most of the results that I showed are done by other people, not by me. And I acknowledge them and also the funding sources. Thank you.
Okay, thank you, Amir. That was a great talk. Enjoyed that. It hit on a lot of important topics, and we already have quite a list of questions. I wanted to know, what do you include in your social costs of carbon? Like, what are you actually including in there?
So the economic evaluations are not something that we do. So social costs of carbon comes from government estimates, and I'm not an expert on that, but I know that it includes a number of endpoints. It includes things like, as I said, property loss due to sea level rise. It includes air pollution and the impact of air pollution, but air pollution that happens because of a changing climate, not air pollution that would have happened otherwise. So as we get warmer, we would have more mortality as a result of air pollution. It definitely includes, and a big chunk of that is extreme heat and the health impacts associated with that. It includes wildfires or estimate of wildfires. It includes various types of economic loss. So it is a range of things. I know that air pollution is a significant portion of that.
Sure.
And also,
go ahead.
Also.
No, I was going to say, if you wanted to get an estimate, actually, I've had this discussion with Senator Galvez, who's footing the bill for the Climate Action Finance Act. And then one of the things she wanted to know was the cost to healthcare. And I'm working with the national group on this issue. But getting an actual cost to healthcare as a result of air pollution, climate change is a really difficult one to do. But I thought about this afterwards, and I thought, well, if you look at Norway, which is now somewhere between 80 and 100% electric vehicles, and just looked at the drop in the drop in ICE vehicle use and the impact of that on the climate, and what the improvement is on health there versus what our health is, because we know that the PM 2.5 is the major determinant of health here, and what that would be if we used only electric vehicles as a starter. But the other problem is that GHGs that are emitted today, they're around for decades. And we're not going to see those health benefits immediately. And then there's the cost of lost opportunity, early death, the decreased quality of life, the cost to the healthcare institutions themselves, and then the cost of researching out new drugs and new treatments and so forth, and the cost of the treatments themselves. So all of those things should be rolled in. And that's in the many billion. We spend 240 billion a year on healthcare. And of that, a substantial portion would be related to climate change and so forth.
And I do agree. So there is a lot of research going into estimating those numbers. And the social cost of carbon is a very expansive effort. And it does include everything that you have, or probably most of the things that you have mentioned. One thing that I do caution against is that including the cost on the healthcare, if you're not as specific, and including the impact of air pollution or the health burden of air pollution, could be double counting the impacts, because some of the costs of the healthcare, for example, is due to air pollution. The disease is caused by air pollution, but not all of it, of course. So my suggestion would be to just go with the numbers that are given, and I think the number that the government of Canada is using is a number that the US has come up with. And it is supposed to include most, if not all, of those items that you have mentioned.
Sure. Art, you're on
It's
deck.
at the global scale. This is at the global scale, so it's not a specific to Canada. That is a difference.
Okay, yeah, no, that's important. So Art, you're next. I don't know if you got my text to you. Art, that's a question.
You can also read the questions.
Art, are you there? Okay, well then Art's question was, he has a question on the models, and there's several used by the IPCC.
Again, that's not, so the models that I use are air quality models. And there are fundamental differences between air quality models and climate models. The main difference is that climate is a chaotic system and therefore subject to larger level of uncertainties, but also different types of uncertainties. The atmospheric composition, atmospheric chemistry is a non-chaotic system, and different parameters. It's also subject to additional uncertainty, but less uncertainty than a usual chaotic system. So I'm not a climate modeler, so I can't really answer that. If Art's question is specific to air quality models, I can try to answer that.
Sure. Anitra, Europe. And then after that comes Dave Doherty comes next.
Thank you very much, Professor Hakami, for most provocative talk. I'm a little thrown off by your definition of life being only human life and health being only human health, because I think it shows the kind of myopia we have as dominion over the rest of the oceans. But we're losing a great many species in the tropical oceans, especially the coral reefs and things, because of the health, because of the sea level temperature rise. And there are solutions, quite simple solutions, that are undertaken by using blue carbon and marine species, where they directly sequester out of the oceans, which contain about 68% of the carbon dioxide in excess. And those are corals, mangrove, seagrass. And the cost is quite good. I have worked that out and given a talk here at KCOR. And it's about a third of $1 trillion to begin this program to lower the temperatures. The second thing is it distributes in an equitous way the labor for doing this between various developing countries, and it would allow people like China and India to participate in a meaningful way. And I'm just wondering if you thought about the global health care, if you've extrapolated what you just showed us in those last maps, which are really very, very interesting, to the question of whether a general solution could be accommodated between China, India, and those very intensively developing countries, and what that kind of damage in healthcare and what that kind of solution would look like. In other words, to extend that thinking globally.
First of all, thank you. I think that's an excellent point. And so climate change encompasses a wide range of, impacts everything. So, and unfortunately, we are not in 1200 or 1300s where one person could know all those different disciplines. I wish we were back then, but different people would have to look at those things differently. You're absolutely right that the impact on the ecosystem health is one major area that I cannot look at. I do not have the knowledge to look at, as is biodiversity. And I think there are measures of that. I am not positive, but there are measures of that included in the social cost of carbon. But it is very much possible, and I would say even likely, that those are undervalued measures. Because, we say that putting a dollar value on human life is difficult. Putting a dollar value on biodiversity is a lot more difficult. And I think that is a limitation that remains. As for your second part of your comment, that I think the data like this, and as I said, people have come close to this level of detail in providing information about the interaction between climate benefits and population health benefits. And for example, we know that China has taken drastic actions to improve air pollution. And that has also resulted to some extent in reduced greenhouse gas emissions, that if they hadn't done that, they would have been worse shape than they are in right now. It doesn't mean that their emissions have gone down. It means that their emissions would have gone even more up than it has so far. So I think the numbers will be there or will become available for those types of regional or hopefully international cooperations to take place. So there is data to support that, but obviously that is a more a political question than a scientific one.
Mhm.
Thank you.
Okay, Dave, you're up. And Ted,
you.
you're on deck.
Thank you. So the first question of two, and they're directly related, concerns the discount rate that we use in economic analysis. Decades ago, the Stern Review said, including a wider range of risks and impacts could increase our loss to 20% of GDP or more indefinitely. And Stern believes that 5 to 6 degrees of temperature increase is a real possibility. At some point, if we get climate change on that order of magnitude, 5 degrees C, might we face more than a 90% loss of GDP as our societies collapse?
I don't know what to say. It's not my area, and I try not to speculate about things that I don't know. But so that I think there's quite a bit of more recent studies, and I'm not trying to downplay the severity of the problem, but I think it's also important to maintain perspective, and I think it is possible. And so the short answer is that I don't know. My guess, my speculation, my uninformed speculation is that there are probably more up-to-date estimates than that. But we all know that, again, climate system is a chaotic system. We don't know where it's going to land, we don't know how it's going to behave. So all those things are possible. But again, out of my expertise, I try to stay away from that.
Talking about stochastic systems, chaotic systems, certainly the economy is one of those. Okay, so the second question is this. Whereas we value the future lives of our children more than our own lives, parents will defend their children to the death. Should the discount rate used in economic analyses be negative?
So this is an excellent question. It's something that has really puzzled me every time that I think about this, because I showed examples of discount rates that $1 billion drops to $6 million by 7% discount rate. But even by 3% discount rate, it drops to $100 million, which is 10 times less. And I honestly think that this is something for lawyers to take to Supreme Court, that should we be allowed to do this type of this is established analysis, so it's difficult to question it. But on a philosophical basis, because the issue of discounting or present value compared to future value is well established in economics, but that doesn't mean that it should be applicable to everything.
Mhm.
I think understanding
It doesn't mean it's right either.
it doesn't mean that it's right. It doesn't mean it's ethical. And I think if I was an environmental lawyer, I would try to assemble a group and really challenge this in the highest level possible. That is this really violation of rights of future humans in this country or on the planet to
Yeah.
value their life based on our today's action, value their lives less, because it has a very tangible and direct impact on the decisions that we make today. If we apply a discount rate or we don't apply a discount rate, if we apply 3% or 7%, it makes a world of difference.
Yeah. Yeah. Well, it'll result in projects either being approved or prevented from going ahead, simply because you said that the value of this person alive today, and let's say 50 years old and in the workforce, is greater than the value of the life of the 1-year-old kid who was recently born and is now trying to learn how to talk.
Yeah, and as I said, I do not understand why this has not been challenged.
Yeah, and it should be.
Again, maybe it has been challenged, and I think it has been challenged, but it hasn't gone far enough, as far as I know. And the problem is that a lot of times things that are well established, we condition ourselves not to question them, and it's one of those things that we should question.
Yeah.
Why? Even if it applies to stock market, doesn't mean that it should apply to climate change.
Right. Great.
And
Thank you
it
very
applies
much.
to investment, yes.
Okay. So, Ted, you're up.
Yeah, I don't believe in economics because Gaia really isn't interested. The biggest problem I think we do is fool ourselves in the metrics we use. And some of us had played games with those. And I have done the same thing as you, sir, in terms of trying to deal with the unthinkable. We did it before some years ago in terms of trying to see how discount rates affected the valuation of renewable resources and other resource decisions, and how we could essentially fight the people who were trying to manipulate the calculations of discount rates to always allow the supermarket to go in and not keep the swamp. And they were having immense success because they tried to reduce all values into those that are realizable on the market. So I'm really making a comment rather than a question, because I'm not sure anyone has a real answer for this. But that's one of the reasons why we started the initiative on well-being, to try and get a wide range of metrics to be applied to broader social decisions. Because if you think economics is awkward, sociology is even worse, and trying to deal with the overall aspirations of people that can be affected immensely by their aspirations. If they believe there's a future, they want to own it. If they believe there isn't one, they'll sell it to you really cheap. Anyway, that's just a comment. If you wish to comment back, please do.
No, at the very least, I don't disagree with that opinion. Any disagreement that I have is a matter of pragmatism. That I don't like economics either. It's just what is the most practical way to move ahead and do something. So if this is fortunately or unfortunately the rules that we play with, or the game is played, better to have good arguments in that space than not to have an argument.
I agree with you completely, and I love arguing with you on that basis. I mean, this is the only way we're going to hopefully define truth, if we can even get our arms around it.
Yeah, there is a tool that's very well known in medicine. It's the cost per quality of life year.
Mhm.
So, and you can
Yeah.
measure that, right? So,
That's
so
another
if you
very
were to-
good metric. Yeah.
it's a very good metric, and you could apply it in this situation.
Mhm.
But then you would somehow need to be measuring it
Mhm.
in areas, say, that have more pollution versus less pollution, and then try and extrapolate from there.
Yeah, so this is a divide between Europe and North America that I mentioned. For example, when they estimate the health burden in Europe, they tend to go with something similar to what Richard mentioned, quality adjusted life years or disability adjusted life years. So which would take into account not just the life lost, but how many years of life you lost. And lost isn't dying. It could also be what is lost to quality of life or to disability.
Mhm. Yep.
Again, so we follow suit for with what the U.S. does, and the U.S. I mean, I wasn't here, so I don't know exactly if how this came about, but I've heard about a time where EPA decided to follow the advice of economists and assign an age-specific value of a statistical life. So basically assign different values to different ages. And, you know, even I, without knowing, I could imagine how that would play out.
Mhm.
So the election year came, and this was known as I think as the death tax, and how it would play to some of the swing states, and never ever did they look back at ever attempting something like that again. And so that's why they go and we go with a flat value of a statistical life. It doesn't matter if that is happening to, you know, someone in older age or a child or in any other situation. Europeans probably a little bit more brave in these things. They do that.
It's very politicized there as well. You may have noticed a little while back that the EPA was essentially banning the actual calculation of certain environmental and climate change variables that they might affect the conditions that would prolong life, viability, and so on. It became essentially they were trying to get out of the equation things that would appear to raise the costs that climate change would have to their society. It's still in the political arena.
Amir, you mentioned direct air capture. Is that something you would still support that?
Again, not exactly my area, but it is to some extent because I mean, you have to make choices. All of this to me comes down to the fact that you have to make decisions. You have to make choices. And right now, no, it doesn't look like direct air capture would be the right choice. But at the same time, if you completely put it aside, it will never develop into the possibly becoming a viable option. So I don't know. I think at some point we may have to, but it doesn't look like it has much room. But even in in Canada's action plan, I think it plays a fairly sizable role.
Yeah. I think it's probably worth reading the letter that Jeff Strong and I wrote in the Globe Mail on Monday morning, and then you'll see what the real statistics are and the value of direct air capture or carbon capture in whatever format you want to do it. It's really it's a bogus, and it's a way of subsidizing the fossil fuel industry.
And
Mark Carney says, well, to go forward, we need to continue to subsidize the fossil fuel industry, but only at a ratio of renewables 4-to-1 against fossil fuels. But that's still taking out fossil fuels out of the ground.
yes, but also the other part of it is that it's very energy intensive. And if you have renewables to run that process, why wouldn't you use those to replace some of the other things that we know that right now are worse? And once you get rid of those, then you can start thinking about direct air capture. And when the ratio is high enough that it would justify. But for now, I do agree with what you say. Another aspect of it is that, like, for example, right now, CCS, I think that is the more maybe a much larger industry penetration than direct air capture, obviously. But CCS itself, if it relies on fossil fuel, one thing that is not considered right now is the health impact of CCS. So even if you capture all of the carbon dioxide, you're still burning fuel to do all that process, which means you are emitting those other things. So the health impact of that process is not as much looked at as just the climate or the CO2 reduction or greenhouse gas reduction impact.
I would go as far as say it's non-existent, the health impact, because it is so small, it's such a tiny percentage that the health impact would be, you wouldn't be able to measure it.
There's also the ethical issue of whether or not those people who are gaining from exploitation and harming others should get us to pay them and reward them for trying to reduce their impacts slightly, just in case. The polluter pays principle has not often been applied within this fossil fuel area.
Mm-hmm. Couldn't agree more. Any other questions from the audience?
I think Samrat had a comment that I think
Yeah, I think
not here anymore, but I just want to say that I completely agree with that. That you know, the north-south divide is lost in all this.
Mm-hmm.
Yeah, I'm back now. If I have a question, Richard, can I go ahead?
no, I don't have any more questions.
No,
No.
I wanted to say one thing, Art, if you forgive me, because the solution I told you about, the capture by the tropical mangroves, coral reef, seagrass, so forth, has a very equitous distribution of labor and a flow to the countries in the tropics, many of which are newly industrializing. Many are the island nations in the Caribbean and the Pacific and the Indian Ocean. So there is a level of that. I'm sorry, Art, that I interrupted you.
Okay, I apologize. I had to step out. The one of the things that has been bothering me as I'm listening to all this is right now the IPCC uses 5 or 6 models, and I'm just wondering, are any of them or all of them now trying to include social costs?
I don't know what the answer to that question is. I said I'm not a climate modeler. So the modeling of the climate on its own does not take the social costs into account. The modeling of the scenarios and how the energy system would develop and its interaction with different economic sectors does have obviously social costs included in it. But climate modeling comes after that. Once you have done that and you know how the emissions would change, then you would drive your climate model. So that's the best I can. Not my area, so I can't really go much beyond that.
Maybe I just give you one comment. Places like IASA are running a whole series of models. And one of the very fun images that I have from seeing there some years ago was essentially playing ping pong with models, where the biophysical model would be running things that were feasible and the socioeconomic model was trying to model demands. And they were bouncing them back and forth to find out whether any kind of rationale optimization could happen. They've done a lot of runs that way, and they were the first people to try and interface socioeconomic demands and reactions, and the capacity of the environment under different scenarios to actually service them. So there's a lot of interesting stuff out of IASA, literally thousands of them just on that subject. But they're all subject to the same issues that we've just been talking about, which is that the assumptions regarding the validity of the data going in, the reactions of people to what they see and so on are still very subject to the use of really very great variability the longer you try and run the models.
Okay, that's great. Ted, I think we're pretty much out of questions. So Ted, I think you can go ahead and thank our speaker.
I mean, these things are always interesting. And when we try and bring groups together from totally different dimensions, we get understandings of how difficult it is to get multidisciplinary approaches to anything, and how to get the politicians to listen to even good advice, much less bad advice. So once again, thank you very much, Amir, for raising the topic, for keeping everybody interested. And we've had a lot of very interesting questions. So I'd like to thank you on behalf of KCOR for helping us have yet another interesting session where everybody sticks around and tries to ask questions that are intelligent. And thanks again. So I will now flip to the commercial, which is that we are now actually, Art, didn't you just suggest changing the name of our this is now to be called KCOR Live, based on all of our Zoom initiatives. And it's the idea being that we are going to continue to have good live events, debates, discussions, and possibly even head-to-head conflict on particular issues of interest. And that is down the line. So we would advise everybody, please join us. We need your money to keep it going. It's not expensive. It's a lot of fun, and you usually learn something. And also, we say that everything we put on normally gets to go onto YouTube, so it's available there for you to share with other people. And please subscribe when you hit the YouTube, because that gives us a degree of presence and a little more visibility. So thank you all again, and now we can unmute and turn on the cameras and chat on any of these issues that you may wish to stick around and do.